So we came to talk with you today about his medications. I just feel that they're not really working, and I honestly feel that he's doing worse than what he was previously before we started all of these medications. I just wonder if we started him on these types of medications maybe too soon, as opposed to letting him develop a little more mentally. I mean, he's only a boy. Like, I don't understand why we put him on all these medications.
Yeah, well, we prescribed him all these medications to try and control the mental illness that he was exhibiting. We thought that they would be the best thing for him. This is how we've always treated patients, and we follow protocol, and that's what we were doing with him. For years, medication has been the answer for almost every problem in the healthcare industry. From infections to heart failure, wide varieties of medications are prescribed daily for children and adults alike. However, there is a key difference when it comes to treating mental health disorders with medications in the population near death. Studies have shown that the use of psychotropic medications has increased as they are less time-consuming and less expensive than counseling and considered a quick fix. Evidence-based practice has shown that the use of these medications on the child mind can affect brain chemistry, alter behavior and emotions, and affect their social development. Giving kids the attention, assessment, and time to be properly diagnosed and treated is much more cost-effective, but also safer. Medication is not always the answer for every medical problem.
I just hate that we jump straight to putting him on these medications to treat his illness. I mean, he's so young, and you can see how he's acting while taking all these medications. I mean, he hates having to take multiple pills in the morning and at night, and I struggle getting him to take them, and it's even becoming a fight with him to try to get these medications. I feel like I have to force them down his throat, and that just makes it even worse on him. Trying to take 6 pills in the morning and 6 pills at night is really becoming a struggle.
For sure. We can definitely look into finding a pill that, combines multiple medications so he doesn't have to take, 6 rather than just one. And just take one in the morning and the evening to make things a little easier for you and for him, of course, as well.
Okay, that'd be great.
When examining the effects of pharmacotherapy for adults and children with mental health disorders, we must take into consideration the effects of these medications. Many psychiatric medications come with unpleasant side effects. Some of the common side effects of antipsychotic medications can include drowsiness, restlessness, nausea, vomiting, and dizziness. Found in a recent study, it is proved that there is a high rate of psychiatric comorbidities. For example, a child with autism spectrum disorder may also suffer from anxiety disorder, mood disorders, panic disorders, obsessive compulsive disorders, etc. It is likely that a child who has autism is being treated with medications. If they have autism and suffer from other psychiatric comorbidities, they are likely to be prescribed more medications to help control these other diagnoses. However, as mentioned in this article, it is questionable as to whether these added-on psychiatric medications are helping the child or hindering the child due to many of the side effects. Today, it has been found that many psychiatric medications can be used to treat multiple different issues. For example, instead of having multiple different medications prescribed for single diagnosis, there are medications available that can be used for psychiatric disorders. This has been proven to improve the functioning level of the child by taking away some of the side effects of being on multiple drugs. Evidence-based practice has shown us that there are well-known pharmacological interventions for the management of psychiatric comorbidities. Second-generation antipsychotics are being used more widely today to treat psychiatric comorbidities along with non-pharmacological interventions because this facilitated a higher rate of functional living and enhances learning. First-generation antipsychotics have many unpleasant side effects. Evidence-based practice has shown that by switching to second-generation antipsychotics, many of these side effects are reduced or eliminated.
And I've also noticed that there's one medication that I believe is causing him a lot of bad side effects. He was started on the prescription Haldol, and I noticed that a few days after he started taking the medication, he was acting kind of funny, like he wasn't walking right. He was just making these like twitching motions, and his arms, like he was extending his head like in a weird way. And I thought about taking him out to the emergency room, but I wasn't sure if this was like an expected side effect of this medication or what I was supposed to do.
Yeah, unfortunately those are some side effects of the medication, and they're to be expected in a lot of our patient population that takes it.
Okay, I don't really know how comfortable I am with that because these side effects are really taking a lot out of him. He mentioned to me how embarrassed he is at school when all of this was happening. The side effects made it even more of a struggle to get him to take the medication because he didn't want to feel that way. Is there anything else that we can place him on?
We can definitely try a second-generation antipsychotic medication. They're known to have less side effects, unlike the one he's currently on, than the first generation, and he may be more willing to medication since they're not gonna exhibit as many side effects.
Okay. We have to consider the side effects that medications are having on patients that are taking them. First generation antipsychotic medications are known to have multiple extrapyramidal side effects. These side effects can include acute dyskinesia, dystonic reactions, tardive dyskinesia, Parkinsonism, akinesia, and neuroleptic malignant syndrome. These side effects can impact a person's daily life and make them non-compliant when taking their medications. Second generation antipsychotic medications are known to have less extrapyramidal side effects while taking the medication. This medication is more desirable and can increase the compliance with the patient. Due to the increase in compliance and less side effects, second generation antipsychotic medications are more commonly prescribed than what they used to be. Evidence-based practice shows us that second generation antipsychotics are better for the patient and should be prescribed over first generation antipsychotics. This has now become the trend among antipsychotic medications. I'm also concerned about how he's doing in school. I feel like his performance has gotten worse since we started him on all these medications. His grades are getting worse, and I've been getting notes from his teachers saying that he's just not focusing very well.
Seth, how do you feel that you're doing in school?
I just can't sit still to do any of my work. I haven't been turning stuff on in time, and I just always feel like I have to be moving or walking around, and I just can't do any of my work just because I always feel agitated and restless.
When children with learning disabilities are put on strong tranquilizers, they are at risk for long-term neurological disorders such as tardive and psychosis. It is estimated that 30% to 50% of people with learning disabilities are prescribed high dose of psychotropic medication. It is evidence-based practice that these tranquilizers are showing no significant improvement on children with learning disability in their ability to perform in school. These children also have limited ability to state the side effects and research other medication options. With these types of cases, it is important to review multidisciplinary actions to help and reduce the dosage of the children on the psychotropic medication. It is also important to try and reduce the number of medications they are on as well. Parents and children receiving these psychotropic medications need to be given significant information about the drug and the reason for the medication.
Do you think that maybe putting him on a lower dose could help reduce some of these side effects?
In studies with high and low doses of antipsychotic medication, it shows an array of results. In this study, it showed that high doses added no positive value to the average patient. High doses were linked to more EPS side effects and more harmful to the body. Blood levels became popular in the 1980s and were significant for research purposes, as these medications were still relatively new at this time. There is still so much to learn from these medications. In this study, it even showed astounding results for such a low tampering in results. Patients that were on 4 milligrams per day of Haldol were at much higher risk of developing EPS side effects rather than 3 milligrams per day. At 3 milligrams per day, patients were at much higher risk for relapsing into an undesirable behavior with less EPS side effects. It is more important for these patients on these medications to have a balanced level in their system to give the desired therapeutic effect.
We can definitely try altering Seth's meds, like I said, to the second generation medication because they definitely do have a lot of less side effects. But since we are starting him on a new medication, I would like to schedule a follow-up in about 2 weeks, see how he's doing with that. And we can definitely see if his side effects have started to go away. And if they don't work, we may need to look into admitting him for observation and then taking it from there and seeing what we would need to do for that as well. Does that sound okay?
Yeah, sounds good. All right, we'll see you in 2 weeks.